this Republican representative, Josh Brecheen, he's a Republican from Oklahoma. He actually went home and did have, during this long-ass August recess, since we haven't heard from Congress at all, he did have a few town halls. He's been plastering his page about how he's having town halls. This is some of the stuff that he's been talking about in his town halls, though. This is the downside.
Yeah. We've got Sharia law trying to be set up in America today. Absolutely we do. You have Sharia law trying to be established in America today. The Muslim Brotherhood is the ideology, and you've got a Turkey president, guys. We're not going to turn into chaos. We've been really good to each other today. Turkey has a president who has made statements relative to reestablishing the Ottoman Empire. And he wants to be...
Look out, bro. Sharia law is on the horizon yet again. It's like, it's like 2008 or something, because Sharia law is back. Did you know that the Turkey president is looking to establish Sharia law? I'm not sure if Josh has heard, but the American president is looking to establish fascism, in this country, where you're standing, where people are chuckling and laughing at you. But it's odd enough that seemed to be the most disruptive portion of this whole thing, because the people kept listening to his dumbass say all these things. And in fact, when they asked him questions where he didn't know how to answer, I don't know why they didn't start throwing tomatoes, but it's probably because they cost too much.
I've heard President Trump say more than once that he has lowered drug prices by 1,500%. I'm not sure how that works. And the other is, can you tell me what specific bills we've passed or worked on that would lower grocery prices?
Yeah. Well, ma'am, you're talking about things relative to state level. And so you're mixing federal and state in terms of if you look at what the 18 enumerated powers say, the 18 enumerated powers that when every member of Congress holds up their hand and swears an oath to uphold and defend the Constitution. And most people who run for Congress don't know those 18 enumerated powers. And they don't know the 10th Amendment that says the powers not delegated to the United States by the Constitution nor prohibited by it to the states are reserved to the states or their people respectively. And so what I'm saying to you is Oklahoma, if you want to have that conversation about grocery taxes, they've been having that conversation. Yeah, but what I'm saying is, but relative to constitutional authority and the way that I have my staff analyze things, what we're allowed to do, okay, what we're allowed to do is, it has to be under the framework. We are given tax status, but tell me the federal tax right now on groceries. So what I'm saying is state. You're talking about state. Who's next?
That wasn't an answer. There's a difference. There's a federal and there's a state. So what are the state taxes on groceries? She didn't ask about state taxes on groceries. She asked about lowering grocery prices, because the guy that you follow behind and sniff his ass, he said he's going to get grocery prices down. That was then until he implemented his policies that made everything get higher. It's weird, but that was his way of avoiding that answer. He knew he didn't have an answer. He knew that everything is getting worse, and he couldn't acknowledge that. So he had to come up with something about the enumerated powers and how the federal government isn't really affecting the state's grocery prices. If that's the case, why did the now president say that he, as the president in the federal government, could affect grocery prices in Oklahoma? Why did he say it? Was he lying to you, or are you lying to us now? What are those conversations that are happening in Oklahoma about lowering grocery prices? Is he saying that leadership, all these Republicans in Oklahoma, should be voted out? Is that what he's saying? Should they be fired? Did Josh Brecheen say that all these Oklahoma Republicans are incompetent and aren't doing their jobs? It's weird, but he wasn't even done.
I grew up on a farm just over the county lines. I'm sure you grew up down native. I want to clarify a few points. You can check this on congress.gov. The text of the One Big Beautiful Bill. It cuts Medicare by over $50 billion, including over $30 billion.
It doesn't touch Medicare.
I think you might want to reread the bill.
Sir, I've been involved in the process. I've been on the budget committee. It doesn't touch Medicare.
It also
Are you meaning Medicaid?
I'm also meaning, well, it cuts Medicaid as well. Largely cuts Medicaid, including over $2 billion for the state of Oklahoma. You have put my hospital at risk, sir. I'm reading my hospital. I must admit, on my phone, I really know how easy it occurred on the job. I'm sure you do too. Why when we can read this and we can read the text of the bill on congress.gov, Why should we believe what's in this?
Because what you're saying is not true. You don't have any facts to back up what you just said.
I agree with that. And I can read
You don't have facts to back up what you just said. I'm sorry. You just don't. And this is a problem. People will make statements and they don't have facts to back it up.
I agree. I agree. That's a big problem, that people make statements and they don't have any facts to back them up. One of those statements being that you're wrong when that gentleman asked him about how this bill cuts Medicare and Medicaid. He's too stupid to realize you're just wrong, sir. You're a dummy. Yet I don't have any answers that'll tell you the opposite. All I said was you're wrong. Here's some answers that guy probably read in the breakdown of that bill. The law enacted in July of 2025 will cut Medicaid funding by more than $900 billion over the next decade. That's what the CBO estimated. You know, that office that all Republicans now say is completely null and void. Here's some ways that they're doing it. Work requirements, provider taxes, reduced eligibility and renewal, and immigrant eligibility. That wasn't even a problem before, but they bring all this stuff up to take away more of your money. And then there was a bit of a discussion back and forth about, is it Medicare or Medicaid that they're cutting with this? Oddly, as again, the guy with the big top hat said, it's both of them. Automatic pay-go cuts, Medicare savings programs, and again, that immigrant eligibility stuff. So this was the arguments that Mike Johnson was having when he said, I've talked to all these people at town halls that I haven't attended at all or organized in any way whatsoever. And all they keep telling me is they want to work in order to get their health care, not pay their taxes, not be an American in the most, the richest country in the history of the world that we always like to brag about. But unless you're an indentured servant, you don't get to go to the doctor. If you break your leg, you don't get to go to the doctor unless you have an exorbitant $10,000 bill. If you get cancer, because, we don't research that anymore. Hypertension, because the guy at HHS doesn't care about that stuff because he's concerned about autism. Now you're on your own. But the guy that represents, and I put those in serious quotation marks, supposed to be representing these folks, what he has to say is you're wrong about the facts, about what everyone knows now that you've signed on to that bill. But he was asked a pretty intelligent questions about what is they could do maybe as far as, providing healthcare for citizens of, again, this greatest nation on earth. There's a direct comparison to another country that does things the right way in this question and answer.
Previously expressed that you want to make America healthy again, aka MAGA. Without the marketplace created by ACA or Medicaid expansion, many wouldn't be able to afford health insurance or health care. In order to make America healthy again, would you support health care reform that offers a public option to all Americans, such as Japan's model, which prices premiums based on income and is available for all residents to opt into if they wish?
So you give me a little bit of information there. I would need to know a whole lot more. I am absolutely in favor of the MAGA movement. I met early on with RFK, with a group of us, because with Marco Rubio, who's now Secretary of State, he allowed me to join him when I first got to Congress on the making all SNAP, formerly known generations ago as food stamps, to make all SNAP purchases be free of the unhealthy elements of dessert and certain things that we know drive up obesity rates for kiddos and just, all the correlations, long-term effects of health outcomes. And so I know, based upon what Callie Means, who's been a large part of the RFK MAGA movement, Callie has told me personally that our bill that I now have with Mike Lee is a priority for them. We're continuing to push that, y'all, that if you are going to be on SNAP and receiving food assistance, we think it's more than wise for the long-term health outcomes for people that may also be eligible for Medicaid, long-term other, when they turn 65, be eligible for Medicare. It is a great investment in its wisdom to make sure we're not allowing the purchase of sugary drinks and prepackaged desserts, and that healthy foods become the standard model again, and that leads to great outcomes, which not only will bless us as a nation, make us healthier, but financially will bless us when the downstream effects of health impacts, and the largest driver of our healthcare cost is hospitalization rates, and so many things can be prevented by nutrition and healthy eating.
This guy's really bad at this. He's asked a very direct, easy question, about how other countries actually have working healthcare systems. But the problem is we steal from our citizens. We extract as much money as possible and give it to rich people. But he couldn't answer. The main thing you need to hear from that answer was he said, I have to know more about what you're talking about as far as public option and the way that other countries do it. I'd have to know more what you're talking about. We know you don't know anything that you're talking about. But he heard Maha and went, yeah, I support RFK Jr. And all RFK Jr. talks about is food additives and dyes and colorings and fatty foods, because apparently that's the cause for every kind of ailment, every kind of sickness, everything in the world